So if you took Cipro and you're wondering how long you need to be worried about the Achilles tendonitis or the tendon issues coming, let me show you some research. In this article from 2010, they talk about the tendinopathy and tendon rupture, and they talk about what clinicians need to know, and let me show you. The tendinopathy caused by it is a little bit of a topic of controversy, but really, I think there's a problem too in the research, because how many people are reporting to their doctors after they took Cipro that they're having tendon issues or tendinitis or Achilles tendonitis? There isn't that reporting. Remember when we had COVID and we were reporting to our doctors and taking the PCR and we were having stats, and we now no longer really have stats the same way? Imagine this. Nobody's going back and reporting. So I kind of think it's underreported, but let's look at this article. The first published article talking about tendinopathy in regards to these drugs was published in New Zealand in 1983. So fluoroquinones have a high affinity for connective tissue, and that means your bone and your cartilage, and it is a big problem because your Achilles tendon is a very big tendon, a very big clump of connective tissue, and Achilles tendonitis rupture is the most serious side effects associated with this drug, with reports markedly increasing, especially with Cipro. So there's a drug category, but Cipro is the worst. A very popular drug that is used orally in the ambulatory setting, meaning when you are talking to your primary care physician. So the World Health Organization surveyed Australia with tendon disorders in association with Cipro and found it to be a causal agent, meaning yes, Cipro can cause Achilles tendon issues, with the risk of tendinopathy appearing to be independent. So when does the onset of these tendon issues happen after taking Cipro? Well, it can be up to a few hours, 2 months, but the mean onset is 6 days. So it can be hours to a week later, up to months later. When I personally have seen it in clinic, it is 1 to 2 weeks later, and people at that point are no longer associating their medication with their tendinitis. They go on to say approximately 85% of patients present in less than 1 month, with 20% having a history of oral corticosteroid use. So certain people have a higher risk of Achilles tendonitis if taking Cipro. So corticosteroids, being elderly, they have not talked about anything that I have seen about EDS, but it makes complete sense that people that have connective tissue disorders to start with, that this drug attacks connective tissue and kind of lives there and gets all concentrated, but it is corticosteroids, elderly. Don't forget, diabetes affects everything about you. So these are just things to know, because you have to be educated as a consumer, and you also need to know how to advocate for yourself. So with this being said, if you are a person who was prescribed Cipro and you didn't discuss with your doctor your recent corticosteroid use, or the fact that you have a connective tissue disorder, or the fact that you are having inflammatory issues, I think you need to make sure your doctor knows that. Now, we don't always have time to tell our doctors our whole life story. So if you're going in for a bladder infection and they say, okay, let's get your analysis, let's take a look at you, okay, your numbers, blah, 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 we're going to prescribe you Cipro. You might not have thought to say, hey, doc, I have a collagen disorder and my body's collagen hates me. That's all I'm saying. I really want people to be educated on what can happen to their body with certain meds, because I don't think we track and report back to our doctors if you do get horrible tendonitis and joint pain after Cipro. I am not hating on the drug. It serves some people well, but I come from a place of I want you to be educated and knowledgeable, because you need to share the right information with your doctor so that they can also help you get the prescription you need that matches your body. Hit the plus sign and follow for more women's health wellness tips. Bye.